In tonight's top story, while vaccines continue to roll out, some people are frustrated with how long they'll have to wait. This includes those who fall at the bottom of the vaccine priority lists.
Nikaya Carrero speaks with educators about how they're feeling.
Workers employed by preschools or kindergarten through 12th grade are the last in North Dakota's Phase 1B COVID-19 vaccine priority groups. But some educators like Chrisanna Peterson say they are not happy with not being higher.
At the time, I thought, okay, we're going to get through these vaccines sooner, but it's been really, really slow, the whole process. And so it's already February and there's only so much left of the school year.
Peterson says one of the reasons they should have been at the top of the list is because of face-to-face instruction as they come in contact with various individuals.
With a lot of people that wanted us to come back face-to-face, it would have been really nice to have at least one vaccine under our belt, because it takes it takes a while for it to work.
And she's not the only one. Minot State University professor Dr. Alexandra Doifel says college-level educators aren't even in the category, which makes her and her colleagues feel forgotten about.
It was disappointing. We were just disappointed to be not thought about at all as educators. Like, where are we in this process? And we're not included.
CDC put together K-12 teachers as well as higher ed faculty and support staff because of the congregate settings that they work in.
In a statement from Immunization Director Molly Howell, it reads, the group is likely to have access to the vaccine in the next month. Staff who are at high risk for severe COVID-19 are eligible to receive the vaccine even sooner. The order of Phase 1B was determined by North Dakota's COVID-19 Vaccine Ethics Committee. And North Dakota United is now working with the Department of Instruction and the Department of Health to keep staff around the state informed.
Being very proactive, making sure that if you have underlying health conditions that you're on a list now so that you can be held at a higher priority.
Reporting for KX News in Bismarck, I'm Nikaya Carrero.
Howell also says the committee prioritized vaccinations for those who are at the highest risk for hospitalization and death.
Which brings us now